thanks for joining us here. So we are launching new patient guides in esophageal and stomach cancer. We're going to have a panel-style discussion here for an hour. And first of all, I'd like to introduce my wonderful panel. My name is Lizzie Smyth. I'm a medical oncologist. I work in the UK. And it's been a pleasure to work with the esophageal and gastric cancer guidelines this year and with our patient group to develop these important patient guides. I would like to ask my panelists to introduce themselves. We'll start from left to right.
Hello everyone, my name is Tihana Gašpert. I am an oncology nurse and I work at the University Hospital Radka in Croatia, and I'm a PhD student at the University of Maribor in Slovenia.
Hello everybody, a pleasure to be here. My name is Zorana Maravic and I represent here Digestive Cancers Europe, which is a European umbrella organization supporting all digestive cancer patients.
Hello everyone, my name is Radka Obermannová. I am working in the Czech Republic in Brno, and I am here on behalf of all authors of esophageal cancer guidelines.
Hello, my name is Florian Lordick. I am a medical oncologist based in Leipzig in Germany, and I'm the first author of the gastric cancer guidelines.
I'd like to thank my panel for joining us today. And first of all, I would like Zorana, who is our patient representative here from Digestive Cancers Europe, to set the scene for why we need these and to tell us a little bit about how stomach and esophageal cancer affect patients.
Thank you, Elizabeth. So, when patients are diagnosed with gastric or esophageal cancer patients, this, as you can imagine, is a devastating news. There are so many things that they have to think about, the symptoms that they have to manage depending on the stage of their diagnosis, the treatment that they have to undergo, and usually what we hear from this patient population and for other cancer patients is that they don't know where to search for information. There is so much support that they need, nutritional support, psychological support. Also, the carers, their loved ones need the support, and through guidelines, I think these guidelines can offer this kind of support.
So I agree. I think, as someone who treats patients with esophageal and gastric cancer, these are diseases that impact very significantly on the patient quality of life, and providing good quality information is important. So maybe, Florian, you could elaborate on why we're meeting, the information that is in the guides. What information are we trying to give to patients through these booklets?
Well, basically, we really try to inform patients or relatives about facts for gastric and esophageal cancer. We are trying to do that in an understandable language. The content that is found in these patient guidelines is exactly the same like we have it in the scientific guidelines that are published in Annals of Oncology and online, but the language and also some figures are dedicated more to the patient language. And we feel that it is very important to inform patients. I give you one example. Once, some years ago, with a PhD doctoral student, I did some research when patients start to feel symptoms and how much time it takes until a cancer is diagnosed. And we came to the result that in average it's 4 to 8 months before the diagnosis was made that patients feel the first symptoms. But many do not interpret them in the correct way. They don't go to the family doctor. They don't follow up on that. So this is, for instance, information that we give in the guidelines, which symptoms can be warning signals. Or another example is the management of gastric cancer, the medical treatments, the surgical treatment. And we really see patients as partners in many of the decision processes. And I think the field is moving more and more into this direction. And to have empowered, informed patients, it's of course important that we present the current knowledge in understandable language.
Thank you, Florian. I think that's really important. And Radka, there are a lot of new treatments that are available for patients with esophageal and gastric cancer. How are we helping to inform them using these guides?
Yeah, this is a good question. So we implemented into our guide also explanation about all new options, new treatments that are coming, and you know that this area is there is a huge development. So we explain all these new modalities like immunotherapy, targeted therapy, and in plain language, so to make it understandable also for patients and relatives.
Thank you. And to Zorana and Tihana, what do you hope that these patient guides will achieve for patients?
Okay, so as I mentioned, it's really difficult to navigate through these diagnoses, and as Florian and Radka explained, there are so many treatment options. So patients need this guide as a reliable source of information where they would be able, together with their loved ones, to sit together, or with their carers, to sit together and to better understand what are their options, to go back to their oncologist or treating physician, to speak with them, to ask questions in order to make best possible decision for them.
Yeah, I agree with you. The diagnosis of cancer and the treatment itself can be really overwhelming for the patient, and it can be really easier for them to have a guide like this with them during the whole time, when they can refer to each time they do have some questions, and to look up for the informations that are available. And then with those information, they can easily go to their doctors or nurses and speak to them about it. Also, it's really good to have it all in one place, because we all know we live in digital area. Everything is in our hands, and there are many good information, and there are also some bad information that we need to make sure that our patients are not influenced by. So this guide can be really good help them to have all the information at one place, and to make sure that they have been informed with all the treatment options, and that they can have information about how to move forward with their diagnosis.
Thank you. I think you do raise a really important point about the availability of information on the internet, and I think that it's very common to Google. It's natural to want to use Google to look up the symptoms and treatments, and having a filter, to show what is, truly helpful, such as in the guides, is very important. And they do raise a very good point in that we also talk about side effects, don't we? And what side effects you might expect. And so also maybe side effects to bring up with your doctor, how we can manage the side effects, and, what the treatment options might be. So really empowering the patient. What do you two think about that?
Again, I'm starting with an example maybe. We have different stages of esophageal and gastric cancer. There are localized stages where different options exist, from the very early cancers that can be resected via an endoscope, going on to the more advanced one where you need an operation. There are new operation methods. There are centers which are very experienced, do that minimally invasive, do that robot assisted. I think when it comes to this treatment, patients should be informed about the options, and the best scenario is when they meet their doctors that they know already a bit about the framework of what are the possibilities. So a better informed discussion with the doctors, with the centers is possible, if this option or that option has a place here. The same, of course, when it comes to drug treatment. We currently have a fast development of novel drug treatment options. There are chemotherapy options, there is biologically targeted treatment, there is immunotherapy. Many of the decisions that have to be taken are also based on the determination of biomarkers. What is a biomarker? It's a tumor characteristic that helps us to recommend the best treatment for a patient. what we see from time to time is that biomarkers are not appropriately assessed. And sometimes I even see patients in my clinic for a second opinion, and they are saying, do you think that they have done everything complete in the other center? And we are going through the sheets, and we say, well, there is still an option here, there is still an option there. We would recommend you that we do this or that, or you go back to there. So you see, the patient is a partner in this process. Of course, we always should be optimal and do anything, but it gets better when there is an informed patient who also sometimes makes us aware of specific possibilities, and even more when it comes to the side effect management. I think that's really one of the most important topics where we absolutely need the partnership of the patients to do a good management of side effects that always occur during anti-cancer treatment.
Thank you, Florian. And I think that you talked about how we choose treatments for patients and working together, sometimes in shared decision making. And Zorana, we talk about this in the guide, and how important do you feel it is for patients to participate in that decision-making process? How is that best done?
I think it is very important for patients to be actively involved, because this is when they feel that they have power, that they're doing something, to be better or to stay better, or for their health condition to improve. And they can only do that by being informed. Therefore, it's really important for them to get this information from their treating clinician, from other sources like this guide, also from patient organizations, because then they can come back and ask questions in order to understand because different treatments are different options, but what does this mean in their particular case? Because each and every patient is unique. So what works for one patient might not work for the other patients. And also based on their goals, because different patients have different goals. For one patient, it might be important to prolong their survival. For the other patient, it might be important the quality of life. You know, I have met patients that say, for me, it was important that I was able to play golf. Not all patients play golf, but the treating clinician needs to understand what are the needs of a particular patient, what is their lifestyle, what are their preferences in order to make the best possible treatment decision.
Thank you. And Tihana, how would you approach that communication with patients around decision-making and goals of treatment?
Well, usually the first reaction of our patients is fear. They feel overwhelmed with the diagnosis itself, and it's hard to raise voice about the treatment options because most of the time you're not involved with it. You do not have the right information, and sometimes you expect your doctors to know all the answer, and sometimes you just want them to decide what is best for you, because at the time it can be overwhelming and very frightening. But if we try our best to communicate with patients and educate them about it, they will have the opportunity to raise the voice and to take concerns about their treatment options, how they want to be treated and how they want to be handled. And in that terms, I think that our part as doctors and nurses can be very beneficial in communication, but as well as patient organizations, because they do have the right information to provide to patients so they can address those concerns to medical healthcare team.
Thank you. And Radka, how do you approach with a new patient understanding what their goals are and giving them the information that they need to reach a new treatment?
Of course, it depends on stage of disease. It's different when the goal is to cure patient, and it's different when we plan the palliative treatment. And maybe I will also find some example like Florian. I am from the Czech Republic, and our old generation, our parents, they are not active patients. Usually we find partners in their children, because usually when you meet a new patient at the generation about 80, they are very passive. They ask us to make our decisions without their input. And I think that collaboration with relatives, with children, with a whole family is very important, and we should involve whole family in this process to make it easier for our patients, also for older generation. But nevertheless, we should convince also older generation that it's important to get the equal relationship in the treatment.
Is the information that you give to a patient different depending on their stage of cancer? You touched on that before, Florian.
Well, I think independent of stage, it is always important to talk about realistic goals of treatment. The goals, of course, are stage dependent, but we always need to talk about goals, which are realistic goals, which are unrealistic goals. I totally understand that the more advanced the disease is, the more some patients, especially in the beginning of the contact, are tending to have unrealistic goals, but we can work on that. We can work on that from appointment to appointment. And in that regard, of course, an informed patient is an easier partner for these discussions, but we have, of course, to talk with all the patients about these goals. And together with the goals, it's always important also to mention the options. What are the options to reach that goal? And I'm coming back here to Zorana,
Yes.
of course, a patient who wants to say, please try everything to make my life as long as possible. I don't want to miss any chance to prolong my life. We may have other options that potentially have more side effects, that are more demanding than for a patient who says, I would like to avoid any side effects. I have this goal and that goal, help me to achieve that, but don't be so aggressive in your treatment recommendations.
Zorana, in terms of the information that we give patients for stage 2 or 3 versus stage 4, and goal setting and how realistic we can be, what do you think is important?
Well, I think it's important to have this open discussion with the patient and really understand their needs. Luckily, I think in the fields of gastric and esophageal cancer, there have been many developments in the recent years. So patients diagnosed today have more options, have more choices, have better outcomes. And also I think this is why it's important to have this discussion with the treating clinician, with the whole healthcare team, including nurses, because what I find on the internet might not be accurate. And also nowadays there are better chances, better outcomes. So I think the treating clinician is the relevant source of that kind of information.
And Tihana, you think the same? The information should be structured according to the patient's needs, of course, and the stage?
Yes, of course. For us, sometimes it can be really logical, and we are all, swimming in the area, but for them it can be really overwhelming and sometimes confusing. And I do agree with you, it has to be covered in a really structured way for them to have all the information that they need.
I think one of the key aspects of the guides is, and something that we can help give patients a baseline to talk about when they come to clinic. When patients come to my clinic, they're often pleasantly surprised that I tell them that most of them won't lose their hair if they've got metastatic cancer, and actually the chemotherapy that we give for stomach cancer previously caused quite bad nausea and vomiting, but now we have very good anti-sickness medications. So in particular, older patients may have had bad experiences with chemotherapy in their family or over the years, and when we can explain to them that in fact there are gentle chemotherapies that we can give quite safely to older patients, it may cause them to think differently. Of course, no treatment is always an option, you know, and I think that we should always give the option of no treatment or this treatment or that treatment, because for some patients they may prefer not to come to the hospital because there's a cost of time, but giving them the most honest and evidence-based information is important. So we've talked about the standard care treatment, and Radka and Florian, I know that you're both very active in clinical trials, and of course clinical trials, DICE is also involved in commenting on clinical trials. How do we talk to our patients about clinical trials? Let's hear from the patient perspective first.
From what we hear from our patient population, clinical trials are an important option for them, and actually they wish for this option to be more discussed. Obviously, it is discussed in bigger centers, but very often they have to search for the information themselves on various websites. And I have to say, it's not really easy to find the information, the relevant information. And also, I think it's important for patients to understand what does it mean to participate in the clinical trial. And this guide offers a simple explanation why clinical trials are a very good option, one that may be even not considered initially. They could go back to their treating physician once they know their stage of the disease, their biomarker status, and all relevant information, and ask them, is there an option for me? Is there something else that we can do?
And it's good because there are many misconceptions, I suppose, about trials. And again, we're coming back to giving a clear set of information. Radka, do you approach all your patients for studies? You do a lot of research in Brno.
Maybe it's important to mention that it's different approach when you suggest patient to be part of a phase 3 trial, when you treat usually with standard of care and you add some new molecule. But there is a particular situation where there is already no treatment for patient, and you have another option to enroll patient, to offer patient to be part of early phase trial, first in man trial, when you use the new molecule, new treatment for the first time in man. And then you have to be very honest to patient, because the primary endpoint of this trial is safety and maximal tolerated dose. And sometimes patients tend to have huge expectations, and you have to be very honest to inform them that maybe we start with a very low dose, there is no chance for efficacy, and that we can offer them this trial to help also the community, but we don't expect a lot of efficacy. And so it's important to stress it, that we take their time, they will not get back. And this is very particular situation, but we don't have a problem with our patients. They are really eager to be part of trials, also in early phase. There is a question.
Oh, sorry, I didn't see.
Hi, I'm Bricio. I'm a medical oncologist from Mexico. As you said, patients deserve to know about the best treatment and the new treatment. But for example, with these kind of guidelines, they can maybe know about new options like IO. But for example, how can we manage if these treatments are not available in your country, or they are not approved, or they are not reimbursed? Because they want it always, as we, the medical oncologists, to give the best treatment to them, but sometimes it's not possible.
I think that's a really, really important question, because these treatments are expensive. They're not available everywhere. Not everywhere has funding within the health service. Personally, I'm always trying to enroll patients on clinical trials, and also sometimes write to industry for compassionate access. But sometimes we need to understand that they're not available, but that the treatment that they receive, even if it's not with the immune checkpoint inhibitor or whatever drug, is still a good treatment. So it's not like there's no treatment, there are options. What do you think, Zorana, about that situation?
From the patient perspective, I'm always for having an open conversation with the patient, saying, this is what is available and what we can do for you. There are other options, because working with patients now for more than 10 years, many patients move to other countries in order to go for clinical trials or to search for new treatment options. And I think they need to be aware about the options that exist, even though they are not available and that you cannot give them. But simply they deserve to be aware and deserve to know about this.
I think that we can talk to our patients, that because maybe they are always looking for the best, and they think that IO, that Pembro or Nivo is the best thing in the world. But we can tell them that chemo is good enough treatment.
Yes.
It's not an all treatment.
Yes.
Because many patients think that chemo is the old stuff. Like Pembro is the unique possibility for you to get cured from cancer. And they have those ideas, no?
I think, Tihana, would you agree that sometimes new treatments can get especially on the internet, get very hyped up, and we have to be honest about the benefits too.
Yeah, we do have to think about the benefits and the side effects also, because usually when the news about the cancer treatment are presented, especially in mass media, they're always hyped up, and the patients are coming to us talking like, this is going to cure me, and I'm not going to have any side effects. It's going to be done in a really quickly way, and I'm going to be cured. But we have the important role of talking to patients about the recent results in the research, and to talk about them, about the real numbers that are being presented, and explaining that to them in a really helpful way, in terms of not using all medical terms, but use plain, simple language.
I agree. Thank you.
And Florian, does this ever happen to you in Germany?
Of course. I mean, it's a common problem that we see from a global perspective. There are some countries, and I'm working and living in one of these countries, where many things are available, where new drugs, new treatments are becoming available quite soon. And there are many regions in the world with large populations where not everything is available for many years. This is really a problem that needs to be solved. Access to care is a big topic in ESMO. From an individual perspective, I would also like to say, and I'm seeing this in many papers we got sent from countries we have partnership in, it's again about expectations. And we really need to see, is the expectation realistic? Should we try to help in an individual situation, a patient, a family, to come to another center, to be involved in a trial? Or is the expectation unrealistic? And that's important to clarify. Sometimes we get heartbreaking letters from families where a history of a patient is described, and we see we could also not help more than the treating physicians in the country where the patient and the family live. And that is something we have to make clear from the beginning, that everything is done on site, that is available, that it's a correct treatment. And even if in principle we have more in Germany, we cannot really alter and improve the natural course of the disease or the prognosis of the patients. This is why I'm saying it is also about expectations, and to clarify if expectations for a new treatment are realistic, if it's really worthwhile to try everything, or if maybe it's unrealistic.
It's good to have that perspective, because sometimes we need to say in a very sensitive way that really moving country, or I see patients who pay to go to America for trials, and I think that we need to have a level of honesty about whether that investment of huge amounts of funding would be worth it for the patient. So we've talked about our new fancy treatments, but there are other things that we can do and give advice on that are not related to chemotherapy or targeted therapy, exercise, diet. And how do we approach that? What is the advice that we can give patients, Tihana?
Well, cancer is more than the treatment itself. It's usually easy to think only about the treatment, both from the perspective of doctors, nurses, and the perspectives of patients. It's really easy to think about the treatment that is going to do the job. It is going to do the job, but it is in our hands, in the patient hands, to take care of themselves so they can know that they can do other things beside the treatment. So they can think about their diet, they can do exercise, they need to quit on smoking, and adapt that kind of healthy lifestyle that can help them during and throughout their treatment. So it is very important to communicate with them and to help them to understand that there are many other things that they can do in addition to their cancer treatment. And that is why it is important that we've involved in the patient guide all those information. And also I think that the patient organizations are doing really great job as a level of support and providing hope and directing patients to the point where they can do something with their own two hands.
Yes.
And well, maybe help them to get better besides the treatment that they are getting.
So Zorana, would you agree, and I agree with you, Tihana, that giving the patient the information that they need to do things that they can be in control of, because often with the treatment, you know, the oncologist is making a suggestion, but this is something that patients can feel empowered to do. Is that where DICE comes in and patient advocacy groups?
Yes, very important, as you have mentioned, for the patients to feel in control of, and exercise and diet is something that they can do something about. Also, it is really important that patients have proper nutritional support, which happens in some countries, while not in each and every country, which is unfortunate. And when it comes to patient organizations and patients coming to patient organizations, we often hear that although patients are supported by family or by carers, that they cannot understand them, and also that they don't feel like talking to them about their cancer. And when they go to patient organization and speak with other cancer patients, this is where they can be open, they can discuss side effects, they can exchange experience, they can find information about where to find nutritional support or psychological support, or just to have that peer-to-peer support that is really important for cancer patients.
In particular, for stomach and esophageal cancer patients, you can find recipes, you know, because after surgery or if they have difficulty swallowing, sometimes the food is unpalatable, and sharing that information is very helpful.
Exactly. This is what we hear from patients, you know, saying, for me, it helped to eat, I don't know, half of cookie at that time, or not to eat, not to drink together with my meal. And this is what only a patient that underwent through that path can understand.
It's so important. And Florian and Radka, so we see patients, I think the evidence that we have in these guidelines for what is helpful and what is not is great, because sometimes patients can be led astray in hope by information that they might find on the internet. For example, cutting all sugar out from their diet or only eating a high-fat diet. What type of information do you give your patients in terms of food and exercise? How do you direct them?
Yeah, first of all, you mentioned that there is a lot of information on the internet and in other sources which is not based on solid knowledge.
Exactly.
And some of these things are quite expensive, so patients tend to spend futile money in that. I find it sometimes almost criminal,
Yes.
what is offered on the internet. And some things are maybe not that expensive but lead into the wrong direction. personally, I'm not giving that much advice in detail because we have specialists for that. We have nutritionists who do that much better than I can do it, or some of my colleagues can do it. So we refer them to the nutritionists. And of course, I mean, in a guide like this one here, and we also have some good ones in German, we give these to patients. And additionally, we also refer them or try to refer them to patient self-help organizations, because this can also be very valuable knowledge that they have an exchange among themselves. I was successful with this or that diet. And we even offered cooking courses in our hospital, which was also quite helpful. And our patient organizations liked that very much.
It's sometimes really challenging when patients approach you with some ideas from internet. So I think that it's helpful to establish nutritional screening in hospitals. So the specialists help you to deal with it from the beginning, and we also schedule the regular check, regular appointments during the treatment, so we can address. They can address all their questions. In terms of exercises, we established some program for patients, some comprehensive program when they rehabilitation program for locally advanced esophageal cancer. To the original idea was to enhance recovery after surgery, to decrease complication after surgery. But this program also overlap with palliative patient care, and also patients who undergo palliative treatment, palliative chemotherapy, are now advised how to perform exercises, what is important, and they are quite enthusiastic about it.
So there's a broad range of information that we can give patients about supportive care, and sometimes we cure patients with stomach cancer and esophageal cancer, which is wonderful, and hopefully this will improve. And what do you think about the advice that we're giving patients in terms of survivorship? Because this is a key part of advocacy groups also.
This is a big topic, and I'm really happy that we are coming there, because it means that patients with gastric and esophageal cancer are being cured. And this is also an area of a huge unmet need, because there are not so many experts that can support the needs of this patient population, because it's very complex. But I hope that we are slowly getting there. There is some information through the guidelines, but also hopefully some experts that will develop in different countries that can support this patient population.
Tihana, what are you doing in terms of follow-up for your patients? What are our recommendations in the guidelines? What could they expect after surgery or after treatment?
Well, it depends where do you live, but usually what we offer our patient is frequent follow-up. Depends on their diagnosis and their treatment. Usually there is a 6-month follow-up and yearly follow-up with both nurses and the doctors.
And Florian, Radka, in terms of follow-up and survivorship, what are we moving in a certain direction for gastric and esophageal cancer?
Well, I mean, we must say that fortunately the prognosis has become better over the past decades. So we see more patients who survive the whole procedure of multimodality treatment, undergoing resection, and even in advanced stages, we are seeing progress, and patients with metastasis have opportunities, at least some of them, to live longer. Therefore, the topic of survivorship is becoming increasingly important. And there are different recommendations and guidelines if you use this or that machine to follow up on this. Basically, it's important that they keep contact with a competent center, that patients ask, that doctors or the team, it can also be nurses, ask for their symptoms, that they get adequate nutritional support, physiotherapeutic support, psycho-oncological support. We really should not underestimate all the processes after having overcome a disease that come then in terms of psychological distress, social problems, return to work, return to family. I think some help in this regard during the acute phase of a treatment is important, but it changes and it becomes even more important in some patients after that phase when a lot of things need to be done. So we really need to follow up on these patients. They need expert survivorship centers. It's not the reality, even not in my country. Many go home to their family doctors who have maybe less experience in treating cancer patients, but I think we should work on that. And a good communication about patient needs in the follow-up in the survivorship phase is absolutely essential.
And I think it's also important to note that these guides sit in the context of many other ESMO patient guides. So, for example, side effect management, immunotherapy, also supportive care and survivorship. So this is one part of a series that patients can access. Zorana, towards the end of the patient guides, we touch on the importance of patient advocacy groups. Of course, this is what you work on. And also Tihana in terms of caregiving support. Could you first outline for us how important patient advocacy groups are, how they came into being, and what they provide for patients?
Within our network, we have 38 member organizations that support patients locally because we feel it is really important for the patient to find relevant information in their own language. And it is great because these guides can also be translated because obviously not all patients speak English. And local patients organizations can provide information not just about different treatment options, but about different centers that are available, options that are available, nutritional support, psychological support, physiotherapy. And for patients, it's really important to have the local information depending on where they live. And they can get this through patient organizations. Also, we have developed a lot of other materials to support patients, their nutritional needs. Just recently, we have developed an app that supports patients through their journey with gastric and esophageal patients, that they can find all the relevant information. So I think that patient organizations can offer a wealth of information to support patients through their cancer journey.
And Tihana, how important is it for supporting families and carers? So there's an extended network of people around the patient.
Yeah, it is. I work in an inpatient unit, so my approach to patient is during their time of their stay at a hospital. And what we have to bear in mind is that we usually have limited time with them, and we do have limited staff, and we have to make priorities. Unfortunately, sometimes I do not get the chance to talk to caregivers or even family because of the heavy workload that we are in. So it is very relieving, actually, to be able to give them the proper information, to refer them to a patient organization that will have all the available information, including the guidelines that is going to be translated in many languages. So it is really important for me to be able to tell them that there are informations that are available, because most of the time they're usually more afraid than the patient itself, and they need to filter out those informations that are given to them. And me as a nurse and being in a position to advocate for patients and to communicate with them, it is a great opportunity to direct them to patient organization who will have the right amount of information, who will offer them some comfort and the level of support.
Thank you. As you suggest, giving the information is to the patient and the carers in the guide. And so we worked a lot on the language in the guides, didn't we?
Yeah.
How important is it for these to be written in a language which is accessible?
It's really important. I mean, as we are all aware, we are surrounded by medical terms all day, every day, and it's easy to get lost in it and to think that everybody understands that what we are saying. but that is obviously not the truth. And it's really important for us to deliver the information in a plain, simple language that could be beneficial for the patient and to help them to understand the cancer itself and the treatment options. It is actually really beneficial for us to read a guideline like this that is written in simple language, just to know how to approach the patient on it, because we can get lost in it too and explain something that sounds really understandable for us, but obviously not for the patients.
I agree. I think that, and I commend the team who put these together, you being part of it, because we actually have the information which is included in the guidelines, which is quite scientific, but in a patient and family-friendly way. So I think that this was, and I see Svetlana here in the front row, she kept us all in order. But I think it's a fantastic achievement to take such high-level information and package it in a way that is accessible to those who do not have medical knowledge. So I would congratulate everyone. And so I suppose bringing it all together, Tihana, Zorana, Florian, Radka, how do we hope that these guidelines will benefit patients and their families? What is the goal ultimately?
Provide correct information in simple and plain language so that our patients feel safe and assured that there are informations that are available, that they do not feel lost in all of those information in digital area, and that they can read about them to get educated about their condition, about their treatment option, and to advocate for themselves when it comes to different treatment options and communicating with healthcare professional. As we all might know, it can be intimidating sometimes. It is hard to speak up for yourself because you don't have the medical degree. You did not learn about the cancer treatment and about, how the treatment works. So for this guideline, I think that the most important thing is to provide information and to speak up for yourself.
Zorana?
I would completely and fully agree on what Tihana said, and I would just add, in order for this to happen, I think it's important that the guidelines are translated and that the healthcare teams provide information that these guidelines are available. Because patients are searching for more information, they need relevant information, and the guidelines are the place for them to find this type of information.
I see these being a great tool for patients to empower them. And I really liked your point, Tihana, of how you were reassured in a very busy clinical job that you can give a patient and their family something where you know the information is there and packaged for them to easily understand, which perhaps maybe we don't always have time to go through every detail. Florian and Radka, how do you feel these guides can help with our multidisciplinary teams?
Let me take my expectation what it could bring to patients. First and foremost, it offers general information about the nature of the disease, esophageal cancer and stomach cancer. And I still, in my clinic, I still see many patients who want to have quite basic information. What is that disease? They want to understand with what kind of disease they are fighting. And this guide, it helps to understand what it is about. It should also help to define treatment goals. What is the next step? What can I achieve with the planned treatment? And I wish that it helps us to have informed patients with who we can really talk as partners which way to go, which recommendation to give, and which way to go together. For the multidisciplinary team, because you were specifically asking, it is of course of help if we have informed patients. It's easier to find the right solution in the jungle of always increasing options. I mean, I said it at the beginning. Meanwhile, often we do not have one option alone. We have several options, and it depends on the preferences and on the treatment goals and expectations of the patients we are treating.
Yes, I think that our guideline describe a patient pathway. So it starts from symptoms. We didn't mention diagnostic procedures. So there is a wonderful explanation of all procedures, and then a different kind of treatment, and then in the end, follow-up or a palliative care survivorship. I think for multidisciplinary point of view, it's important also for, especially for our surgeons and anesthesiologists, because when we, for the first time, when we talk with our patient, we also introduce all our other disciplines, and it's easier for patient to understand and also easy for surgeon to take over.
I completely agree. But we mentioned that the landscape for treatment in gastric and esophageal cancer is changing very rapidly. And when I shared these booklets with my clinical nurse specialist team, they were very glad because it showed very clearly the treatment options that were available, because these have changed 2 or 3 times over the past few years. And so that they could give the right information to patients, they were happy to share this almost as a Bible, to say, this is our standards and this is what we would offer you here. And there are some treatments which aren't available in the UK, and we can say, well, this is not available in the UK. And I feel that this has been a very helpful baseline document to share with patients. So this guide is in English. ESMO is an international organization. So I guess we're asking the question, how do we translate it? Will it be available in different languages in future? And I think patient associations can approach ESMO. There is an email to ask for translations of the documents, which will then be made available. Maybe Svetlana, you could comment, are there any translations available at the moment?
At the moment, we have the guide only in the English language, but we are pleased to collect any interest. As Lizzie mentioned, on the website, we have the patient guide dedicated email address, so every organization is very welcome to express the interest. And we are also very pleased to add the different languages on our website. And we have also dedicated web app where we will list different translations.
It's great. So they are available in many different modalities. So we know that not all patients are able to access the internet. The app is great for those who are internet friendly, but we also have printed guides which are available, and they can be downloaded and printed out also.
So printed guides are also available at the booth, so everyone who is here can also collect a personal print copy at the booth. And we are also collecting the interest for distribution through this patient guides dedicated email address. So everyone, every institution who wants to distribute, we are welcome to ship the copies.
It's a wonderful resource, and I would like to thank Svetlana also for her contribution and the ESMO team for helping to put this together. I see we have an audience, so I'm wondering if we have any questions or contributions from the audience who've been listening.
Hi everyone, and thank you so much for this talk. And I was wondering if you are suggesting some kind of give an accompaniment with the patient. I don't know, maybe it's a section with the nutritional, maybe the treatment. And for example, I don't know, doctors, if you speak with the patient and you say, well, I'm planning this treatment, but please read these guidelines, or maybe you read the guidelines with the patient and then, I don't know, go to the nurse, and then the nurse as well do the same. How do you suggest, or can you give us some kind of advice for better using these guidelines to the patients?
Maybe I'm starting here because you were also addressing how we are approaching patients with these guidelines. Yes, we do that. We see not many situations in oncology where we have to push decisions within one day. And often we give some information we tell patients, take your time over the weekend, talk with your family, and take your time to take your decision, and we will have another appointment in 2 or 3 days, and then we may be able to take a decision. Often even factual things still need to be done, some assessment on CT, some biomarker information from pathology, and explicitly we try to offer our patients written information, valid written information to get informed about a certain chapter. And for this, a guide like this one here is extremely helpful because we can rely on the information that they find inside, and they will not get crazy by searching in the internet on maybe unreliable resources.
And maybe I can add that it's also important to share one guidelines with all your team to use the same language with your nurses, with chemotherapeutic specialists, with surgeons, anesthesiologists. And I think it's important, it's easy first step, it's easier than give to the patient just informed consent for chemotherapy. It's better to inform them honestly and properly.
Perfect.
Thank you so much.
In Oxford, we now give it out. I got a big box of these from Svetlana delivered. And we have a folder full of information which we share with the patient at their first visit, which is information on the hospital, information on the services that are provided by our cancer service, our emergency numbers, information on the chemotherapy that they receive, and now we also include this. And then, as Florian said, they will usually come back to us and formulate a plan, and so I'm very happy to know that they have received good information from which is accessible to them and will help them make decisions.
It's maybe interesting for you to know we have a certification system in my country. So specialized centers get a certificate, independent auditors are coming every year. And one element, not the only one of course, but one element is access to valid information for the patients. So we also keep it in the waiting rooms. They check for it if we give access to valid information by certified resources like the ESMO Patient Guide to our patients. It's maybe interesting for you to know. It's seen as a quality criterion in our country.
Fine. I think that we've had a wonderful session. I would like to thank all my co-panelists, our patient advocacy group representative, nurse specialist representative, our 2 guidelines authors, Svetlana and the Patient Guides team. It's been a pleasure to produce such a useful, I think, document, and I think that ESMO should be proud of the efforts that they're making towards informing patients about their treatment. Thank you very much.
Thank you.